So if you're a person who's had a positive test result for COVID-19, we would put you what we call under isolation. And isolation is different than quarantine in the fact that when you're isolated, we ask that you remove yourself from everyone, including your family and your home. You stay within a single room with the door closed. Use an individual bathroom, not to share it with your family. Don't eat meals with your family. Don't use utensils. Don't share utensils with your family, things like that. So what we do in public health is try to support them by asking what their needs are during that 10-day period. Do they have food? Do they have a way to do laundry? Things like that to help try to eliminate some of those stressors for them. So it's a little different than quarantine. A quarantine would be if you had contact with someone who is positive for COVID-19. We ask that you remain home, separate yourself from other people except to go to a medical appointment. Remain 6 feet apart from everybody in your home. We ask that you remain quarantined for 14 days. And this is because oftentimes you don't have symptoms if you do become infected with COVID. It could take up to 14 days for you to show symptoms or to become sick. So what we see is that if you can remain home and away from everybody else, then you avoid spreading the infection regardless if you have symptoms or not. And by day 14, you're usually free from becoming infected. We contact the person under quarantine every day to see if they have any symptoms of COVID-19, to see if we need to ask them to get tested, or to ask if there's any needs that they have, if they need to see their doctor. So we are keeping in contact with them every day.